Hello again, everyone, and welcome. Once again, my name is Tina Costin. I'm one of the directors with the PHSA Office of Virtual Health, continuing to be your host for these virtual sessions. And again, my pleasure to welcome you or to re-welcome you to the 2023 BC Digital Health Forum, inspired by Canada Health InfoWay's Digital Health Week. Want to take a moment to encourage all of us joining in this virtual circle to share in our collective gratitude for the opportunity to come together from many traditional, ancestral, and unceded territories of BC First Nations. May we all take pause to honor their connection to this land, their stewardship in caring for and nurturing these lands for all time. And let us also give thanks for this opportunity today to gather, to learn, to collaborate, and to provide care on such beautiful lands. I now have the pleasure of introducing our next presenters. There's three of them, including Jat Chopra, Annie Chen, and Sarah Rajan. Jat is a highly regarded leader who currently works with the PHSA Office of Virtual Health. Jat has extensive experience in healthcare, previously working in various roles at Change Healthcare for nearly a decade. He is a project management professional and is responsible for leading complex virtual health initiatives while working in collaboration with a diverse set of partners across BC. Annie holds a combined degree in computer science and biology from UBC. She's passionate about growing her skills and knowledge within the field of digital and virtual health to better increase the accessibility of healthcare for all patients within the province. Sarah also works with PHSA Office of Virtual Health as a coordinator, supporting the planning and implementation of virtual health initiatives across BC in collaboration with clinical, operational, and corporate partners. She holds a Master of Management degree and a Bachelor of Arts degree, both from UBC. Sarah is passionate about leveraging digital health tools and technology to create a more accessible and equitable healthcare experience for patients and looks forward to presenting on the recent initiative. Please join me in welcoming Jat, Annie, and Sarah for their talk on Partnering for Progress, a collaborative journey to procure a provincial remote patient monitoring solution. Welcome all.
Thank you, Tina, for that very warm welcome. Good afternoon, everyone. As Tina mentioned, my name is Jat, and I'm joined by my colleagues, Sarah and Annie. And today, we are very excited to present about the recent province-wide request for proposal process to procure a remote patient monitoring solution. To begin, we'd like to highlight our team and partners that were involved in this project and share a quote about teamwork by Henry Ford that really emphasizes why this project was as successful as it was. The quote is, "If everyone is moving forward together, then success takes care of itself." This RPM RFP was one of the largest RFPs for a province-wide virtual solution, which required extensive collaboration and involved many folks. The RFP was led by Mehdi Tabaji and Arlene Singh with guidance from the Ministry of Health and was conducted in collaboration with our health authority and organization partners on the screen, as well as our patient partners across the province. Sarah, Annie, and myself helped to support various aspects of this RFP as well. This RFP would not have been possible without this team, as well as the individuals from the Office of Virtual Health team who jumped in to support various parts of this project. So our plan for today is to begin by sharing more about the project, its background, scope, objective, and guiding values. We'll then dive deeper into the different phases of this project and highlight the different partners that supported each phase on how we were able to meaningfully collaborate with them. Finally, we'll end with some key takeaways and actions that folks can use when navigating similar province-wide collaborations moving forward. So as we get into the project background, just want to share a quote about virtual care. So virtual care is the future of healthcare. It's not just a convenience, it's a lifeline, which brings medical expertise to your fingertips. And to get everyone on the same page in regards to remote patient monitoring, or RPM, so that refers to the delivery of healthcare to patients outside of conventional care settings. For example, a patient's home, which is made possible by connecting the patient and their care team through technology. Some of the key benefits include reduction in acute care and clinic visits, improved access and continuity of care, improved patient empowerment, improved patient satisfactory and quality of life, improved and sustained control of health conditions. I'm now going to pass it on to Sarah, who will share more about how this RFP came about.
Thanks, Jat. So the impetus for this province-wide RFP really arose from three key perspectives. So starting from a patient perspective, there was a real interest in enhancing existing use cases of remote patient monitoring and expanding use cases as we move forward post-COVID-19. So examples of current use cases include heart failure, COPD, and cancer.
And from a clinical and health authority perspective, the COVID pandemic really brought along with it an increased usage and interest in what remote patient monitoring could do. This increased usage really meant that the needs of the province were evolving at quite a rapid pace. And so the goal of the RFP from this perspective was to find a solution that could not only keep existing programs running, but that also had the potential to grow and change along with the needs and interests of the province. This group also wanted to keep in mind what the future state of remote patient monitoring could look like for the next 10 years or so.
Lastly, from a Ministry of Health perspective, the existing contract with TELUS Health was set to expire after 10 years, and thus to ensure continuity of programs and care across the province, an RFP was issued. And Sarah, back to you.
Thanks, Jat. So this is a slide that summarizes the RFP in numbers. And as you can see, there were a lot of opportunities for collaboration with 10 participating organizations, 4 vendors, 3 committees, and an average of 60 participants in the demonstration sessions. Another notable stat is that over the course of the project thus far, there have been about 70 hours of group discussions, including in-person sessions where multiple partners were able to come together in person and test potential RPM solutions. So as you can see, there were many opportunities for engagement and collaboration, and we were able to sustain quite a consistent level of participation throughout this project, which was a real highlight for our team. So I'll now share more about the scope, objective, and guiding values of this project. So unlike other RFPs for virtual care solutions, this RFP involved partners from across the province, providing additional challenges, but also a unique opportunity to collaborate with all health authorities on a high impact project and pilot what a provincial approach could look like for RFPs moving forward. And the main objective of this RFP was to enhance virtual healthcare delivery and identify an RPM solution to better meet patient and clinical needs across the province. And we're happy to share that we were able to be successful in meeting this objective and we're able to move forward with a successful proponent. So as we move into the contracting phase of this RFP, the outcome continues to be of relevance to all stakeholders involved as remote patient monitoring becomes an increasing area of interest for clinicians and patients. Demand grows for virtual care delivery, and more RPM solutions continue to be offered from industry. Finally, while reflecting on the RFP and in preparation for today's presentation, we identified a few values that we feel guided our approach to working with so many partners on such a large-scale project. These were a few of the values that guided our approach throughout each phase of this RFP, and we'd love to hear from you folks as well, so please feel free to share additional values that you would add to this list in the chat. So as you can see, collaboration, innovation, and patient-centered care were key values for our team. With regards to collaboration, we asked ourselves, how can we best work with each of our partners to successfully meet the objectives of each stage of the RFP, from gathering requirements to testing solutions? With regards to innovation, we asked ourselves, how can we foster creativity and innovation both in how we work as well as with the successful proponents? And last but not least, with regards to patient-centered care, we asked ourselves, how can we ensure that patients are at the center of everything we do and that their perspective is being included, as ultimately these are the folks who will be most impacted by the final outcome of this work. So having these guiding values really helped to align our team's priorities and keep us on track when making major decisions throughout this project. I'll now pass it on to Annie to share more about each phase of this project and how we were able to work with each of our different partners.
Thank you, Sarah. So in the next few slides, we'll delve into what some of the key stages were for this process and which partners were involved at each stage. So on this slide, you guys can get a high-level understanding of all the partners that we worked with as part of the RFP. Each of them offered a different perspective and had their own unique motivation and needs. As part of our work, we had to acknowledge and account for this throughout the project to ensure we had buy-in from everyone that was involved. These unique viewpoints and motivations really formed the basis of our engagement strategy with each partner. An example of this is using our patient partners. What they wanted was to have their perspectives as patients included throughout the process. Thus, when we engaged with them, we really tried to create as many opportunities as possible to have one-on-one or small group interactions so they could feel more comfortable sharing their perspectives and lived experiences. Now, moving on to the first year of our timeline. During this year, Canada Health Infoway put out a national request for pre-qualified vendors. As part of this, a list of pre-qualified vendors was created, and we used this to narrow down our list of prospective vendors. We also worked with various health authority and health organization partners to gather and validate requirements for our own RFP later on that year using various collaborative tools like Monday.com. In the second year, we worked on obtaining guidance and strategic direction for this RFP through collaboration with a different health authority and health organization executive leadership teams. As part of this, a working group was formed and a terms of reference document was created to guide the project. We also began recruiting and onboarding patient partners at this time.
Starra?
So the past year, year 3 of this project, is when we really collaborated most actively with our various partners. So we worked with our vendors to organize virtual demonstration sessions in which vendors were able to present on average to 60 individuals, including patient partners, leadership, clinical staff, and working group members. We then organized a sandbox testing session for all 10 partners plus patient partners, which allowed everyone to test each vendor's products and follow up with vendors at drop-in sessions to ask their questions and better understand their products. And finally, we worked with all health authorities and health organizations to collect evaluations and scores for each vendor, and were able to work with PHSA procurement as well to lead a province-wide consensus meeting to select the successful proponent. And for each of these activities, we organized several meetings and debrief sessions to ensure that each of our partners, from working group members to patient partners, were able to contribute their feedback and felt heard.
Looking ahead to the next year, we're now turning our attention to sharing our experience and lessons learned from presentations like this one to support others in navigating similar provincial collaborations. We've also begun contracting with a successful proponent and will continue to do so in the new year. And in parallel to working with the vendor and PHSA procurement to create a contract, we'll also continue to work with our team and health authority partners to create an implementation plan.
So as you can see, over the last 3 years, there have been many opportunities for collaboration to procure a remote patient monitoring solution for the province, and different partners were able to come in at different times to offer their input and expertise. And again, we're so grateful for the opportunity to have worked with so many partners to move this important work forward and ensure that key partners had an opportunity to contribute to this procurement process. And while there have been many lessons learned throughout this multi-year project, we have identified some key takeaways specific to the theme of this year's presentation: people, products, and change, as well as some general best practices for long-term, large-scale projects, which Annie and Jat will now share.
So as Sarah mentioned, we'll just quickly talk about some of our key takeaways and what we found to be some critical success factors. Our first takeaway is that partner engagement is absolutely crucial. We could not have completed this work without actively listening, engaging, and collaborating with all our various partners. The first takeaway also strongly affects our second, which is the importance of selecting a solution that aligns with everyone's needs. To do that, we had to work with numerous parties to come to an alignment on what these requirements and needs were. Our third takeaway really applies to all projects, and that is being able to continuously learn and improve based on feedback through all phases of the process. An example of this was when we were trying to figure out which collaboration tool to use. The first one we had introduced didn't receive a very warm welcome, and so we moved to a different method of collaboration instead. While this sounds like a very small roadblock, it had a huge impact on the project overall. And I'll now hand it over to Jat to talk about the critical success factors.
Thanks, Annie. Some of the critical success factors that we learned throughout this project were as follows. So we really needed to nail down the purpose and scope. So we wanted to ensure clear communication and alignment with all our partners. Governance, we wanted to make sure leadership was involved, and we outlined all the expectations for everyone involved. Communication, just communicating frequently and openly, just so everyone's aware of where the project's at and where things are headed. And collaboration, so seeking out and including various perspectives, ensuring all partners feel heard. And finally, adaptability, so staying flexible in our approach and incorporating lessons learned and feedback along the way. As we close things out, I'll leave you with another nice quote here about remote patient monitoring. So remote patient monitoring is a game changer in the world of healthcare. By providing real-time data on a patient's condition, healthcare providers can make informed decisions about their care and improve health outcomes for their patients. We want to thank you all for joining. We're now going to turn it over to just a question and answer, see if you guys have any questions about our presentation today.
Wonderful. Thank you so much, Jat. Thank you, Annie, and thank you, Sarah, really for sharing your experiences with what is a really large provincial project, as you've mentioned. Really appreciated the guiding values and the key takeaways. All of these will be invaluable as we continue as a province to work towards a more connected healthcare system and connected community, especially if we do see more provincially procured solutions in the future. We do have one question already in the chat, thinking about those key requirements. So the question is, what are some of the key requirements and or criteria of the RFP? Were there any surprises from engaging the patients?
So there was a lot of requirements that came out. Annie, maybe if you want to get into specifics, but there was a lot of, so in terms of the collaboration involved, there was sessions that we held with all the health authority partners just to, like we mentioned before, have everyone's voice heard and see what requirements were critical to them. So we prioritized the requirements based on what each health authority felt was needed from their aspect. But in terms of specifics, Annie, do you recall any specifics that came up during those requirement sessions?
I think based off of kind of what we talked about, a lot of it was based on existing use cases, as well as any improvements that people thought could be added on to those. So those could really evolve around clinical workflow or things that they experience in their pilots or projects with something that the patients may have brought up that wasn't working with them for them. So generally things like that.
And jumping in here to address the second part of that question regarding were there any surprises working with the patient partners? I think our experience working with patient partners really highlighted the fundamental reason that we do involve these folks in the work that we do, which is that we're able to learn more about their experience as patients and their lived experience of what they go through on a day-to-day basis when they're interacting with various parts of our healthcare system, and hoping to incorporate this technology into their health management moving forward. And so no specific things that were surprising, but we certainly were able to gain a better understanding of the patient experience by having these patients actually be able to interact with the vendor solutions and share their insights and feedback with us. So thank you for the question.
Great, a couple more questions coming up. What are some of the new use cases that you hope to cover with the new RPM solutions? Annie.
I guess I'll take this question. I wouldn't say we've specifically identified new use cases. At this point, we are going to see if there's anything specific that people might want to try, and then we will work with them, see if it is potentially possible with the system that we have, and go forwards from there.
Sarah, so you want to add?
Just absolutely, just wanting to add on to that. And that's another phase moving forward when we think about project planning and moving into the implementation phase of really involving our clinical partners to best understand what would be the best use of this type of technology and our vendor solution. And so again, that work hasn't happened yet, but we're really looking to understand how we can incorporate the clinical perspective and ultimately better support patients' clinical needs.
Great.
Thanks, Tina.
Thank you. An interesting question, and I'm not sure how much you'll be able to speak to it, but one of our audience members is asking, what was the outcome? Which vendor? What were the satisfaction measures with the product chosen?
Unfortunately, at this time, we are in contract negotiations, so we can't divulge any of that information at this time, but it is forthcoming. We are working hard with the PHSA procurement right now to conduct that work. But yeah, sorry, at this point, we can't answer that other than we're currently in negotiations from a contracting perspective.
Great, thanks, Jat. I figured that might be the answer. One other question, we've got some time. Were there any challenges specifically around privacy and security when it came to what vendors offered in terms of their solutions and data management?
Any vendor that we would have looked at or procured would require a privacy security assessment. So to answer the question, yes. So they really need to meet our requirements in terms of a privacy and security perspective in order to be considered for as a proponent.
Great. One last question from the audience. What modalities did your team explore in the applicability of RPM in the current healthcare landscape?
One, I'll say one, and Annie, and sorry, you guys can jump in if you want, but engaging with patient partners, so using the patient partner network. We had Arlene, who we mentioned in the slides at the beginning. She really worked with the patient partners to engage with them and gather that clinical feedback to see how, how the solution we were looking at was going to affect them from a patient perspective, and then incorporating those requirements as a part of the RFP.
Great. Another question just popped up, and I think we might have time for it. The province has asked for development of hospital in the home projects. Did you interact with any of those developing programs, particularly Island Health, which has 2 years of experience?
Yes, we did. So Island Health was a part of the requirements gathering process for this RFP, and they were extensively involved.
Great. If you guys are open to one more, I think just time, that was a quick answer, is if you might be able to elaborate on the specific challenges faced during the collaboration process and how they were overcome. What strategies might have been proven most effective in ensuring a smooth collaboration, particularly between, say, the Ministry of Health, provincial health authorities, and healthcare organizations?
I can start us off, and then Annie and Jat, feel free to jump in. I think one particular challenge that comes with collaborating with so many different partners really revolves around being able to understand the different perspectives that folks are coming from, right? So we had various health authorities involved, and obviously every health authority has a geographic region that they are responsible for with different patients and different clinical needs. And so one of the things that certainly came up was when we were discussing particular solutions or particular clinical use cases, each health authority had different priorities and different factors that they were looking for. And so obviously moving into our evaluation and scoring piece of this RFP, that was one of the things that became apparent as something that would differ between each of the health authorities in terms of collaboration. And we really needed to create the space for each health authority to share their priorities and their feedback and their perspective, and facilitate those conversations in a way that were productive and allowed everyone to be able to contribute their perspective, and obviously feeling safe and respected enough to do so. And I would like to personally say I think that's something that our team was able to do well and successfully, and that was some of the feedback that we also received in our post-project evaluations, which we didn't particularly touch on today, but that certainly were done in this project. And I'll pause here with that, and Jat and Annie, feel free to add on.
I don't think we can top that answer, Sarah.
Great. Well, thank you again, Jat, Annie, and Sarah. Great presentation. We're going to close it up and just say thank you one last time. There's still a few questions coming in, so don't be surprised if people reach out to learn a little bit more about your process and your learnings. To end the session, again, we'll deploy a short poll gathering your feedback on the session and how you felt about it. And as we wrap up this particular session, we're going to go straight into our next one, which is entitled Bite-Sized Innovations in Pediatric Health, 5x5 with the Digital Lab. So we'll see you shortly. Again, you can navigate to the next session via the panel on your left-hand side in feed loop. And we look forward to seeing you all there.